I have problems with my heart. So then you're gonna tell them, okay, so, because you have to ask a little more questions, right? So when that happens, and then they're gonna tell you, as I'm going upstairs, I live in the third floor, no elevator, I have to walk. Back in the days, I could go up the stairs, I didn't have no problems, but now I'm having problems. As soon as I get to the second level, I have to stop and rest and take a breath because I got shortness of breath. All my chest started hurting. So that's basically what it is. That's the reason why we do an exercise in electrocardiography, because we need to know what happens and how agitated you are, you know, when you actually develop that chest pain. Because if we do an electrocardiogram right in the office, the patient is not gonna, the changes are not gonna be anything, it's gonna be normal. Why? Because the patient is not moving, is resting, and they develop that chest pain when they are moving. This one, the patient comes to our office, we do an electrocardiogram, everything is fine, but the patient is complaining about shortness of breath, chest pain. So the doctor is gonna decide, we're gonna send them for an exercise in electrocardiography, or we're gonna send them for a ambulatory monitoring, right? So the doctor makes his decision. So whether they go for one or for the other one is up to the doctor. So the doctor says, okay, I'm gonna send this patient for an ambulatory monitoring. Because when we do the electrocardiogram right there, you are relaxing, so we need to know. Here, we need to know when you're resting and when you're moving. So remember, one, you're resting, the regular one that we're gonna learn how to do. You come there, you lay down on a table, we apply all those electrodes, we connect them to the cables, to the leads, and then we enter the information in the EKG machine, print out a copy. That is one. The other one is when you're doing during movement, so you're walking on a treadmill. This one, we're gonna check both when you're moving and when you're resting, because we are going to give you this. So we're gonna apply those electrodes in your chest, no arms, no legs, because remember the patient is gonna be moving and we don't want no interference. So those electrodes are gonna be on the patient's chest. This time, we're gonna reduce the number of electrodes. We're gonna have between 5 to 7 electrodes. Sometimes they even have machines or manufactured companies that they produce an Holter monitor with 3. But 3 doesn't capture much, right? So we're gonna have a kind of half of the electrodes. So we have between 5 and 7. The most common is 5. So we're gonna see how that works. Right here. So it says right there that an electrocardiogram that we are going to process as the patient go around his or her daily activities is going to be, once again, an ambulatory monitoring. If you see here, how many electrodes you see here on this patient? 3, correct. But the most common is 5. We're gonna see where they are located. See, this is the little machine that is recording the electrical impulses of the heart. Here, this machine, this little device, has, back in the days, it was a large one, and it has a little tape recorder, right? Then they changed it. It was a CD, a small one. Now they have one of those chips, just like a telephone, right? Our cellular phones. They have a little chip right there, and this is gonna be with the patient for a period of 24 to 48 hours. It can go to 72 hours depending of what the doctor needs to find out, just in case in 24 hours and 48 hours the doctor don't capture much information, we might extend it for 48 hours. But the most common is 24 to 48 hours. So the patient comes to the office, The doctor orders one of these ambulatory monitoring, and then the medical assistant gotta place those electrodes. How do you know where are you gonna place those electrodes? How do you know where are they gonna go? According to the manufacturing company. We always gonna follow the EKG machine. Who made that EKG machine? Is that understood? Whether it's a halter, whether it's an EKG machine, whether it's a treadmill, we're gonna follow their instructions. Remember, these are questions for days. Whenever you've been asked, if you need to learn about where or how to place the electrodes, or how many of them are gonna be used for this particular test, the answer is the manufacturer's manual, the manufacturer instructions always. It's not asking the medical assistant, the doctor, or the nurse. Because usually, whenever we don't know something at home or in our workplace, we ask someone, right? Here, the real thing is the halter. So you're gonna just do that. The manual. So the manufacturer company, that is what you have to read. Remember, for how long is this patient carrying this halter? 24 to 48 hours. Remember, while they're doing their daily activities, they should not stop anything they have been doing before. If you work in a company and you work in a computer, you work with something else, you gotta do your job. What you do not do is something that goes beyond what you usually do. You're not gonna stop your daily things. Going to the store, going to the park, buying groceries, sitting, watching TV, all those things normal that you do continuously, you're gonna continue doing it. One of the most common ambulatory monitoring is called Holter. Holter is the last name of the guy, whose name is Norman. Norman Holter invented. This guy was not just a regular guy. This guy was a cardiologist. So whenever you're gonna buy your halter, or the companies are gonna buy a halter, then you're gonna look for the name, right? This is like when you buy cellular phones. Which one do you want? Oh, I like this and I like that because of this, because of that. Well, you select it. But this is one of the most common. So now, if they ask you a question in your national exam, I'm not familiar whether they ask this question. Nobody has brought this to me, because usually when the students take the test, they tell me, oh, professor, I got a question, I didn't know what it was. So I said, remember that? But I totally forgot. So the name of the most common halter is, the most common ambulatory monitoring is Holter. Remember, they're not gonna ask you the name Norman Holter, but just Holter monitoring. That's basically what it is. It said right here that it has between 3 to 5 leads. So leads are the cables. Anytime that you talk about leads in an EKG, is also the printout. Because remember, lead number 1, lead number 2, lead number 3, ABR, ABL, ABF, V1 through V6. But here, all those leads are these cables. Leads, that's what it says, 3 leads. So that's basic. And they are connected to this device, which is the halter. That was an old device, as you can see right here. For this one, we had to put a little cassette inside. Then there came an updated one, and it was a little CD, small one. Now we have a chip that is gonna have within. Now, when we record all the information, as this machine gather all that information in that CD, in that tape, or on that chip, Then we're gonna bring it and we're gonna insert it in the computer because it's like an SUV. So, no, SUV, no, it's a USB. Oh, I'm always with cars. I'm telling you. I just got a car for my son, so my head is USB. So you put it right there, and then on the screen of the computer, we're gonna see all the recording, and we're gonna pass it over, and the doctor is gonna read it, it's gonna evaluate it, and it's gonna notice what's going on. We're gonna see these halters, they mark the time. Every single minute is marking the time. So if you develop chest pain at this time, it's gonna capture it and it's gonna tell you what time it was done. And because we're gonna need something else, you're gonna see, we're gonna know what the patient was doing at that moment when you develop that chest pain, that shortness of breath. Is that understood? So there is a lot of stuff right here. Once again, it needs to be interpreted by a cardiologist. Electrocardiograms needs to be always interpreted by a cardiologist. They are the specialists. I know how to read EKGs, but sometimes they are so complicated, little details, we can miss them. And that can be very serious, because remember, when it comes to problems with the heart, we cannot miss anything, because then we're going to be, the patient is going to be in trouble, and we are going to be in trouble. How is an ambulatory monitoring used? Now, just like we have done with all the EKGs, it is to capture abnormal heart rhythms. So anytime that the patient's heart is not functioning normally, because normal rhythm, we're not worried, but we always do it to capture whether the heart chambers or valves or blood vessels are working normally. That's basically what it is. To monitor effectiveness of cardiac medication, just like we did with any of these electrocardiograms. Remember, for the exercise electrocardiography, we say the same, right? To check when the patient has cardiac medications for the heart, when the patient has a surgical procedure on the heart, any type of these situations, we're gonna use either of the three standard methods for evaluating the heart. It's just that all depends on the symptoms of the patient that we're gonna use either or. Most of the time we use the one laying down, and that's the basic one, and then we decide whether we send you for a exercise electrocardiography, or we give you one to take it home and return it 48 hours later. To evaluate pacemaker function. Remember, this is to evaluate someone who has an artificial pacemaker. We're not talking about the normal pacemaker. Well, it does, but most of the time we use it for a patient who has a pacemaker, an artificial battery. To evaluate the heart after recent myocardial infarction. Anything that has to do with the heart, we're gonna use this, because this is to monitor how the heart is working. So anytime that there are changes in medication, surgical procedures, symptoms of your heart, we're gonna decide which of these monitoring devices we're gonna use. Remember, sometimes the patient doesn't know when the chest pain actually, what the chest pain was triggered by. So sometimes the patient, oh, I was doing this, oh, I was doing that. I don't recall, I was just sitting watching TV, and then suddenly okay. So we're not sure. And because we are not sure, we are going to give you one of these halters to take it home and we're going to talk about now how is this monitor placed, what are the recommendations, what are the preparations that the patient has to have when he or she is carrying this halter. This halter can be used for children, for adults, for elderly, anyone who needed to be evaluated. We have different types of variations of halter or ambulatory monitoring. We have continuous monitoring, we have intermittent monitoring, we have telemetry, and transtelephonic monitoring as well. So once again, we're going to talk about each one of them. But as you can read it, the words imply exactly what you're reading. It says right there, continuous monitoring. What it means? That we are continuously seeing all the beats, all the changes that you're having. So let's talk about the patients that are hospitalized or the patients that are brought to the emergency. They are hooked to one electrocardiograph or the machine that produces an electrocardiogram, and continuously you see all those waves go up and down, and it's beep, 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 right? When something is wrong, an alarm is going to go off. So that's continuous. We are continuously seeing. Anybody who goes there see on the screen all these changes. We're going to see the heart rate. We're going to see the blood pressure. We're going to see the pulse oximeter. So the oxygen levels. So we always going to check, and then we're going to say, oh, this patient is good. So then people start moving around. Intermittent monitoring. Anybody knows what intermittent means?
Is it like for a certain period of time?
Correct.
Well,
On and off. Usually we call it on and off. So whenever you see this question, because intermittent is one of those questions they like to ask on national certification. So what is an intermittent monitoring? It says that it is on and off. That's basically what it is. But they ask you like this, on and off monitoring means what? You look for it intermittent. Is that understood? So that's basically what it is. So we're going to have these monitors that only are going to be showing all these waves up and down from the electrocardiogram when the patient is presenting symptoms. Other than that, the monitor is going to be blank. Is that understood? But when we have a continuous, we're going to see all the time, whether it's fine or not, all the time. Here, we only want to set it up by default that when the patient has symptoms, we're going to see something. Telemetry. Telemetry is the one that we're going to have right there continuously. So it doesn't change at all. This is the one that we see in the hospitals. One of the things that we can do with this is that we can check it remotely. So we can, from any distance, as long as we have a computer and we have internet and we have access to that monitor, we can see it from everywhere, from any part of the world. It's like you having cameras in your home somewhere else, and then wherever you go, you just check your phone or your electronic device, and you have the application over there. You can see what's going on. Transtelephonic monitoring. This is a telephone that is being used. We use the cellular phone, and then we are going to pass all the information through a cellular phone. So all these Holter monitor or all this ambulatory monitoring, we're gonna pass that information, connecting it through the phone. So let's say that you have one of these devices, because mostly this is used to check the artificial pacemaker. So whenever you have that, then we are not gonna be there, and you don't have to come to our office for checkups or return anything. No, we can have the reading of the EKG through your cellular phone. So we set up an application, and through that application, you hook up the little device or a cable, like a little connector, and then you just connect it to your cellular phone, and that cellular phone connects with the computer with the doctor, and the doctor can read all the information of your electrocardiogram. So that's basically what it is. So I gave you the information, here it is. Continuous. So we are going to be seeing everything that is going on with the patient continuously. As long as the patient is hooked up to these machines, we're going to be seeing. Patient can activate an event marker. What is an event marker? When the patient feels symptoms. Let's say that because it's continuous, right? So sometimes we kind of miss that there was something wrong happening right there. So we explain the patient, we tell the patient, if you are feeling some symptoms like shortness of breath, chest pain, immediately punch or press this button. Is that understood? On the little machine, anytime that you have symptoms. So that's what is called to activate the event marker. Traces the exact time symptoms occur. Because remember, these devices have a time clock right there that is going to mark exactly what time, what minute, what part of the day this happens. And not only that, later on, we're going to talk about something else that the patient is going to enter in a diary. The patient has to have a diary as well when they're going to tell what they were doing at that time. So then we compare the time of the day or the night that this happens and what you were doing at that time. Is that understood? So it's not that difficult. Intermittent patient activates recording only when symptoms occurs. Most of the time, your screen, the little monitor, is going to be blank. But as soon as you develop symptoms, then immediately you press a button, and now we're gonna record that. Now, this is with the purpose of fast reading what really happens. See, if we continuously have a monitor on the patient and it's saving, is recording everything that is going on, do you know how long it takes a cardiologist to review all these hours, all this tracing? And it turns out that you didn't have anything. But if we just have an intermittent one, it's going to be a lot easier for the cardiologist. But the cardiologist just going to go there and says, oh, here it happens. At this time, the patient was doing this. Because it's only going to show bad things, if you will. So when the actual symptoms are happening. Can be evaluated more quickly than continuous. That was the explanation that I just gave you. Because I can go see it, and as soon as I see it, everything that I see is where the symptoms were happening. Not just that I have to go through every single thing. And at the end of the day, probably not finding anything. Maybe be voice activated. Well, technology. Things can be just giving a command instead of just talking to them, instead of pressing any switch buttons right there. Telemetry. Now, the key for this is it is a continuous monitoring. But this is a continuous monitoring that you can monitor from somewhere else. So remote. See, transmit to a central location where multiple patients may be monitored. See, hospitals. we don't have a nurse to be to live right there where the patients are, right? We're gonna have a nurse for each room. Okay, nurse, sit there to see what happened to the patient's monitor. No, we can, I mean, that's kind of waste of time, right? And money, because this nurse can be doing something else. But yet, we need to be monitoring these patients. So what happened is, we're gonna have like this, what is called that thing, the tower on the plane, on the airport, right? And you've seen every single plane that is coming, which one is taking off, which one is landing, and so on and so forth. Here, they're gonna have one person or two people in one room, and you're gonna be checking all these monitors. And you don't need to be like standing right there in front of the monitor, because they're gonna beep when something wrong happens. Then they just gonna check, said, oh, this is room number 1, patient floor this, or this department, and they're gonna call the nurse in charge on that department to go and check on this patient. So that's basically what. So they have all these monitors, all these cameras that are reflecting over there on those monitors, and then, the control tower, that's what it's called over there. Patient's diary not required. Here, we're going to talk about the diary, but here, because the patient is hospitalized, we don't want them to keep a diary. We're going to have a diary when the patient takes these monitors home. That's basically what it is. This is the transtelephonic, remember? Primarily used to evaluate the pacemaker function. That is when the patient has, once again, these artificial pacemakers. Now, see, these are pictures from very, very early days when they come out with this. Can you imagine that is a Nokia, I believe, phone?
I have one of those.
Yeah. So this is connected to the monitor. Now this is transmitting the information to the cardiologist, and the cardiologist is seeing what's going on with the patient. That's basically what it is. So right here, the information is stored in the monitor, then transmitted via telephone. So that's basically what it is. So that makes their life a lot easier, because I don't have to go to my cardiologist. From home, I can just connect my phone to the Holter or whatever monitor you're using for ambulatory monitoring, and send that information to the doctor. And they're gonna check it out. And they're gonna tell you the results. Remember that these are cables, because the patient is moving, the patient is doing the daily activities. These cables can detach from the electrodes, right? So for that reason, we recommend the patient that if they got loose, they can put it back. They can press on it. Remember, later on, we're going to talk about all the recommendations that the patient has to follow, what to do and what not to do when they are carrying this Holter monitor on them. So that's basically what it is. If the actual electrode falls off, they have to come back to the office, because we have to apply a new one. There is no way that one that already got loose is gonna be put back and function. It's not gonna work. Okay, patient education. Very important, this aspect of this process, because if we don't give the proper explanations, education, direction, guidance to our patients, they're just not gonna do the right thing, right? So, a diary. Remember, we want the patients to record every single activity that they are doing at home, because we're going to compare the time, the activity with the recording. Other than that, the patient have a chest pain, but we didn't know what the patient was doing. So we need to know exactly what the patient was doing at that particular time when the patient activated the symptoms button, or simply that the machine captures the problem. So the diary is very important for that. Have the patient repeat the diary instructions. This is called feedback. Remember, every time that you give instructions to the patient, we're gonna do two things. One, we're gonna give verbal instructions. Second, we're gonna give them written instructions. Now, I mentioned before, every single time that we give written instructions to the patient, we're gonna give written instructions in the language that the patient speaks. What will be the sense for me to give this to a patient who doesn't speak English and give this in English? They're not gonna understand it. Oh no, but his son speaks English, her daughter speaks English. No, because it's the patient who needs to know and read and follow all these instructions, because it's the patient who's carrying this monitor with them. Who say that the child is going to be with them 24/7? They have to do their own things, they have to go to school, they have to go work, whatever they're doing. But the patient that is carrying that monitor needs to have this information in the language that they speak. Remind patient of any medication changes. Once again, whenever you carry this monitor, the doctor might give some medications, stop some medications, because we need to know exactly what's going on with your heart. So that's basically what it is. This is an example of how a diary might look like. So the diary is going to tell you the things that you have to record right there. It's like an application, okay? So it's gonna tell you what to follow, what to do, what not to do. So the day that the patient is being given a halter to take it home, we, talking about the medical assistant, writes down the first entry. Is that understood? Here, these are the blanks. This is the timing that we're gonna write down depends on the time that we gave the patient the monitor. And from then on, we're gonna tell the patient to keep on writing the time every single time that they change activities. So let's say, for instance, the patient went 9 in the morning to the hospital. The halter was given around 10 in the morning. So the patient is going home. So with the monitor, after we apply it and is ready, we're gonna make the first entry. 10 in the morning, the patient receives the monitor. The patient is walking outside the office. Is that understood? So during this period of time, it's walking. If something happens, we're gonna ask the patient, if you develop chest pain, shortness of breath, headache, anything after now, or like kind of you have a dizziness, record that information right there. So right here, activity, walking on the hallway, symptoms, the patient become dizzy. Anything that happens to the patient, whether it seems that it's related or not related, if it is something that regularly you don't get it, we need to know what's going on. Is that understood? So that's basically what it is. So now the patient is going to this bowel movement. VN means bowel movement. The patient went to the bathroom to do number 2. It's not that he's gonna record himself doing it. No, he's gonna say, I went to the bathroom to take number 2. That's it, the time. Because people have died when they go into the bathroom. Why? Because sometimes you have to strain. People develop something that is called constipation, right? That it is very hard for them to get the stools out. So in that process that they are kind of straining themselves to get the stools out, the heart works faster. So they can collapse right there, they can die. So we need to know what you were doing. If you go to pee, I went to pee at this time. If there is any symptoms during that process, that event, you're gonna write it down. So you have to be very clear about everything that is going on. The patient sat on the couch and the chair to watch TV. At 10 p.m., 7 p.m., I sat in my couch in the living room to watch TV. People die when they are resting, when they are watching TV. Not that there was a scary movie, no. It's just that things happens. That's why we have a monitor that is going to be checking not only that you have symptoms during activity, some movements, some exercise, but also it can happen at night or when you're resting, when you're relaxing. If you went to eat, so you have a lunch, you have dinner, you have to write it down. I sat on the dinner table to have my dinner. During the whole process, nothing happens, you don't record anything. But if something happens, symptom happens, you have to record them. You went to the store to buy something, you have to record at what time did you go. Now, it sounds like a little intrusive, but if you're having sex, you have to write down there that you were having sex. People die having sex, particularly guys. Guys suffers more of heart attack than women. So it's not like you're gonna be intrusive, but we need to know what activities are the ones that are causing you discomfort so you know how to address these conditions. So that's basically what it is. Any questions? Well, let's see more specifically right here. What is recorded in your diary? It says right here, every single activity that you do, you have to record it. Here are some of them. And we mention them because people sometimes think, oh, I don't need to mention that.
But what if we have those activity, but we don't have symptoms? Do we still?
If you know, you put the activity, the time that you start doing it. If you don't have symptoms, you don't write anything on the symptoms.
Oh, but still record the activity.
We record, of course, because you don't know whether you're gonna have symptoms or not. And the machine, sometimes, probably you don't feel the symptoms, but the machine captures that you were having something, because some people think, oh, if I collapse, oh no, I got a little dizzy. Oh no, that happens to me all the time. So they kind of disregard it. Oh, I feel a little pressure right here. Oh no, I don't think that, and that was not a chest pain. No, but the machine captures that during the EKG. I need to know what you were doing. If you felt the symptoms, it's a lot better because you tell me right here what activity you were doing, what symptoms you developed. See, during the bowel movement, the patient didn't have no symptoms. The patient was going to do something right here, no symptoms. So if there is no symptoms, even better. But we need to know what you were doing during that time, just in case the machine records something that we know what you were doing. Other than that, it's not gonna make no sense. So what is the purpose of us giving you a Holter to check your heart function during this period of time, 24 to 48 hours, if you're not going to have all the information that we need? See, urinating. If you go to the bathroom to urinate, you have to write down. Bowel movement, remember, it's doing number 2. Sexual activity, remember, we have to mention it. Walking, emotional upset. You got upset for something. You have a fight with your son, with your daughter, with your wife, or somebody else has called you to argue about something. Remember, when we get upset, what happened to our heart? It goes, the blood pressure goes high. Eating, when we eating, also can cause some changes in our circulation. Sleeping. I went to bed at this time. That's it. So you're gonna tell at what time you went to bed. You can tell, oh, I was sleeping, I was having dreams. Well, you're not gonna be able to do that, right? But yes, what time did you go to sleep and how you were feeling at that time. If there is any symptoms, oh, I woke up and with a nightmare or to go to the bathroom, you have to write it down. Remember, particularly older patients, elderly patients, they woke up not once, not twice, probably several times during the night to go to the bathroom, to pee. That's very common. So whatever you're doing, once again, you just have to record it. Things that the patient needs to know during the ambulatory monitoring. Remember, the patient has to prepare themselves prior, during, and after. So we always need to know all the phases of all these procedures. Says right there, during the procedure. So after, before you go for this procedure, the doctor is going to tell you, okay, the day that you come here to get the monitor, please wear these loose clothes. Why? You don't want something too tight. That kind of blocks circulation, number one. Number two, all these cables that you're gonna have attached to your chest, if it's something is too tight, maybe it's gonna rub against and it's gonna get them loose, right? So you want something that it is comfortable for you. Now, pay attention to this, because this is something that the patient should not do. During the 24 to 48 hours that you carry this monitor, you should not shower or bathtub. You should not take a shower or have a bathtub. Well, you have a monitor, you have a device that is electronic. So you shouldn't do that. Now it says you can have a sponge bath. What is that? You take a wet, of course, towel, and you just kind of dump yourself, clean a little bit. But once again, be careful with the cables that are attached, because you can unplug them, disconnect them. When sleeping, make sure tension is not applied to the lids. This is one of the issues, the problems that the patient have. Because remember, when we are sleeping, we move around. We toss and turn, right? In any of these situations, these cables are there. They can move, they can detach. So be careful with that. If you notice some of the changes, just try to fix it up. Avoid magnets, metal, anything that can cause, remember, electrical interference, those electronics. One electronic that I have right here, remember we talk about EKG being kind of away from electronics and any electrical equipment that might be close by. Check monitoring equipment for proper functioning. Always make sure that your monitor is turned on, because accidentally we can turn it off when we're sleeping, when we're turning and tossing and turning. Now, I'm gonna go sleep, so I'm gonna remove it. No, you should not remove it, because we need to record straight continuously for the period of 24 or 48 hours. Now, I'm gonna turn it off during this time because I'm gonna be doing something. No, I'm gonna take a shower, I'm gonna remove it. No. Remember, you should not take a shower for that period of time. Your health is more important. So that's basically what it is. You can actually go work and all the stuff with the monitor. Sometimes you cannot see it. Well, all depends on the type of work that you do. Patient's education, explaining the procedure and answering questions should alleviate the patient's fears. Remember, we always scared, we always apprehensive. If somebody gave us a device, attached device to our body, we're gonna be kind of apprehensive, right? A little scared, thinking, okay, is something gonna happen to us with this machine right there? No. Explain then that this is not gonna cause no electrical to you. You're not gonna get electrocuted or anything else. That's another thing when you are going to do an EKG, a regular EKG. The patient seeing that you're applying all these electrodes, now those cables, now you're gonna apply this machine. They never have an EKG before. Tell them that this procedure is painless. You're not gonna feel anything. Because as soon as they see this machine being connected with all these cables, they think that electrical impulse charges are gonna go through them. No, explain that none of these are going to happen. So that's basically what you need to understand. We're always going to be kind of explaining to the patient what's really going on during the procedure. Ambulatory monitoring for children. Now, remember that these are very little people. So for that reason, we gotta treat them a little different than adults, right? And most of the time, remember, we gotta deal with the parents. You guys most of you have kids, or you have little brothers, little sisters, nephews. And you know how it is when you bring your child to the doctor, right? You want your child to be taken care of first. Your child is in worse condition, even though if it is not, because you don't care about your neighbor, you don't care about the next door person in there. So your child needs to be first. So that is normal. So here we are going to make sure that we greet the parents. Remember, because the little kids, they just there, maybe screaming or something else. But we're gonna greet the parents and we're gonna try to make sure that we communicate with them continuously. Otherwise, they're gonna give you a hard time. Things that you need to prepare yourself for the procedure. So, gathered equipment, monitor with holder and strap or belt. So, back in the days, because the devices were so big, they have to have a strap, a shoulder strap. So you kind of carry that thing like a little bag or purse on the side. Now, on the belt, you have a clipper and you just put it right there because this is very small. So that's basically what it is. Batteries and tape or disc. Remember, that happens back in the days. We don't have no more halters with the tape or with the disc. Now we have the little chip right there. Everything is more advanced nowadays. The devices are very small, so easy for them to be kind of, to carry them. Electrodes, 3 to 5, depends the monitor that you're using. Remember, it's very common, the 5 one. Lead wires, of course, you're gonna have the electrodes attached to these wires and to the monitor. Alcohol and gauze, remember we had to clean the area, just like in any other electrocardiogram. We're gonna clean the area when we're gonna be applying those electrodes. Patient's diary, do not forget about this patient's diary, because without the patient's diary, the electrocardiogram is useless. We're not gonna use it. We're gonna see what happened if the patient didn't complete this. Skin preparation materials. If it is male, most of the time males are the ones who carry the monitor. I'm not saying that women know, but males are the ones that suffers more of heart conditions. So we're gonna have a shaving equipment, tape. See, these electrodes, they are very resistant. They stick to the skin strongly. But guess what? We're gonna make sure that they stay there. So we have some tape, mostly surgical tape. So we put it over. So we cross over to make sure that we fix those electrodes right there. And no matter how you move or sleep, these electrodes are gonna be kept in place. Patient education checklist. Remember, we're gonna have the diary and we're gonna have all the things that the patient are supposed to be doing or the things that you're not supposed to be doing. Because that's basically how it is. Manufacturer's directions for the monitor. Of course, you have to have the manufacturer guidance or the guide, so you know exactly how to apply, how these function, what is the correct way of applying the electrodes. Remember that those electrodes are color code, so you need to know where the white goes, where the red goes, where the black goes, and so on and so forth. Of course, you have to have a pen. Why? Because the patient needs to fill out the diary. So we give them the pen, the diary, and the pen, because if we don't give it to them, then we might say that they didn't have one, right? Before the procedure, prepare monitor and review instructions. Every single time that we're gonna do a procedure, make sure that you get verified in advance that your equipment is working. Can you imagine giving a patient a monitor to take it home with all batteries that are not working? No, we have to turn it on for them. We gotta make sure that we change the batteries, that the batteries are new, or the batteries have been charged. Because remember, it can be these monitors that can be charged just like our phones. Check monitor charge, see? Insert blank tape or discs if required. Now, once again, we gotta make sure that this monitor has the new chip, because every single time that the patient returns this monitor, we remove the old chip and then we place it in a envelope with the name of the patient and send it to the cardiologist, right? Alongside with the diary. So that's basically what it is. So tape or the little diskette, that's not happening anymore. In order for you to be using these Holter monitors, you have to work with the cardiologist. Is that understood? The cardiologists are the ones who has all these. Regular doctors, they don't have this. They refer you immediately to the cardiologist. prepare the patient. Now, once again, just as we did with the regular EKG, we're gonna ask the patient to remove their clothes from the waist up. At this time, the patient can be sitting, can be laying down, it doesn't matter. But we need to be comfortable with placement of these electrodes. Provide a drape, remember? You can give them the gown, you can give the drape. Remember, they're gonna become cold and you're gonna protect them, their privacy. That's mostly what it is. Says right there, keep the patient or have the patient sitting or laying down. The patient has to be relaxed. Remember, you're applying these electrodes. Explain the patient that this is painless, that no electrical current is going to pass through their bodies, because they see all these cables and these machines or these devices, they're going to get a little scared. Now we have to clean the area first and then we're going to dry it. Do not clean and apply the electrodes immediately after. Allow the alcohol to dry. Other than that, it's not going to allow these electrodes to stick or adhere correctly on the patient's chest. Here it is, the placement of the electrodes. You're gonna have right there, exactly like this, a little image where the electrodes should be placed. So right here we have 1, 2, 3, 4, 5. So you have to place it exactly in the same locations as this one. Depends on what, the manual from the manufacturer is telling you. So it is there, you're gonna see right there on the front of the manual, it's gonna have the picture, the image, and you just follow the color code. That's basically it. So we have here a white and a brown. Then we have right here a red and a black and a green. So just follow the position, the locations where they place it. That is it. If you follow that, it says right there, follow the manufacturer instructions for electrode placement. So that's really important. We have to have a little of care, very cautious when we dealing with elderly patients. Now, the reason with elderly patients is that the skin is very fragile. And if we abrade too harsh, we can actually break the skin. And remember, breaking the skin is going to cause the patient to develop an infection. So we don't want that. So we're going to clean very nicely. I remember that I took my mom to get to the emergency because she was having some chest pain and she have a heart condition. So they put an IV, right? When they put the IV, they put that Tagamet, so that little plastic or adhesive that they put to hold the needle in place, right? So the needle does not move themselves. When, like at the next day that I went, well, I was there the whole night with my mom, but when the nurse came over, it says, okay, your mom can go, just the results are here, your mom is under control. The guy came over and removed that tape, but removed it too fast. Hello.
Gina texted you?
Huh?
She told you I was gonna come in late? Gina?
Who?
Gina?
No.
No? Oh, sorry. I told her I was gonna.
Probably they did, and I didn't check my phone. So I told the guy, I said, listen, be kind of, nice, be a little slow, don't pull it off so fast. And the first thing he did was, boom. Well, my mom's side of the skin start bleeding. Not because of the needle, no, because it was stuck right there and her skin was very fragile. So then I said, I told you already. Oh, I'm sorry. I'm sorry it doesn't fix things. Just listen. Sometimes you can put a Band-Aid on an elderly patient and you remove it, that Band-Aid can pull off your upper layer of the skin because the skin is very fragile. So with elderly, we have to be very careful. It's not just doing the job, it's trying to do the job without causing any harm to your patients. See, avoid abrasive cleaners. Remember, with a normal person, with a younger person, we can kind of go there and kind of scrub a little bit and the skin becomes red. Not bloody, but red. So we're just gonna remove, so the electrodes kind of adhere very strongly right there. But with the elderly, we cannot do that. See? Using caution with applying and removing the electrodes. For the elderly, this is what I do. When the electrodes stick so much because on the skin, because it's so fragile, they're gonna stick more. So if you try to pull them, you're gonna rip the upper layer of the skin, I'm telling you. Leave those electrodes on them. Leave them. They can take it home. When they take a shower, those electrodes are going to come out by themselves. So don't cause them a little trouble right there. Yeah, we're going to help them, but we need to understand that when they are elderly, we can cause other issues, just not for not being careful with them. Applying the monitor. Attach the lead wires to the electrodes. So we clean first. Remember, we have the patient to remove, close waist up, always, just like doing any electrocardiogram. But in this case, we're not gonna apply 10 electrodes, we're gonna apply only 5 or 3, depends on the manufacturer. Arrange the lead wires comfortably on the patient. Now, when it says comfortably means we are going to touch the wires and we are going to put tape over the wires. A little piece of tape right here, a little piece of tape right here, so we make sure that these wires are not moving. So we kind of fix them. So when they put the clothes and they remove the clothes, it's not going to be touching these electrodes. See, tape each electrode in place. The electrodes also, we're going to apply tape on top of the electrodes to reinforce them, not to detach, not to come out. So we always have options there. Attach cable to the electrocardiograph and run a baseline EKG. So as soon, just like we did with the exercise electrocardiography, the first thing that we do when we attach it, press record an EKG with the patient resting. Is that understood? Then when we start doing the treadmill, the patient start walking on the treadmill, we're gonna have, and we're gonna compare the one that we have at rest right recently and all the changes that it's going to have when the patient have the other days. So here, before the patient goes home with the Holter monitor attached to their body, we're going to get a base electrocardiogram at rest. Now we know that the machine is working, that the patient can go safely home, and knowing that we're not going to have issues recording anything because it was working to begin with, because we did a test. So that's basically how it works. Now that we finish applying these electrodes, we're going to ask the patient to put the clothes back on. So that's basically what it is. At this time, we are going to attach these cables to the little monitor or halter, whether it's on the patient belt, whether it has some shoulder strap, whatever they have over there. Whatever ways are they applying this to the patient to hold it on place. Check lead wires and electrodes. When the patient dresses, remember, we're gonna make sure that as the patient was dressing, putting their clothes back on, they didn't detach anything, they didn't move the cables, then everything is right. Says right there, start monitor, have patient make first diary entry. So, as soon as we apply that, the patient is ready to go home, we're gonna give the patient the diary. Remember, the diary is like 3 or 4 pages like this. A little booklet, and it's gonna say there, what is it that you have to record? Remember, every single time that you do any activity, you have to write down the time. I'm gonna walk to the store. 10 a.m. walking to the store. When you return and you sit in the couch because you're tired, 11, I'm sitting on the couch. 11:30, I went to the bathroom, number 1. Number 2, I'm sitting on the table to eat. Whatever actions you're doing, you have to record it on the diary. Bless you. Review all patient instructions. Remember, we go over the patient's instructions verbally and in the paper, and we tell them, all the instructions that I'm giving you are right here. So, now that I remember, so that's basically what it is. So this diary, remember, is very important. We're always going to talk about law and ethics, HIPAA, OSHA. When applying an unfamiliar type of monitor, follow the manufacturer's directions, always. If directions are unavailable, consult your supervisor. See, sometimes we have the machines, but we don't know where the manual is at. Well, every single machine that we use in our office have to have the manual right there, because remember, for these halters, we need to know exactly where you're gonna apply each electrode, following the color code. If we don't have it, don't just randomly go and apply them wherever you feel like it. Can you imagine you have 5 electrodes, 3 electrodes. If there are 5, you have different places to apply them. If you have 3, there are 3 different places. You need to know according to the device that you're using. So that's basically what. Remember, this is question for the exam. Always, when you're applying, when you're using a new device, new machine, from where you get the direction, so the guidance. It's not your supervisor, it's not another medical assistant, it's not the doctor, it's the manufacturer's, remember, instruction. The patient went home, carried this Holter monitor for 24 to 48 hours. Now, the patient returns back to the office because the time is up, right? So they bring the monitor. So they cannot remove it themselves. They cannot turn it on. Oh, 24 hours now, I'm gonna turn it off, I'm gonna pull it off, and I'm gonna bring it like that. No. You bring this monitor and allow the person who placed it on the first visit or the time that it was given to you, bring it back, and the person will remove it. what happened right here? It says turn off monitor and detach leads wires, but that's gonna be the medical assistant or whoever is there when the patient returns this Holter monitor. Remove tape and electrodes. You're gonna remove everything. Now you're gonna clean the skin if there is any kind of residuals, marks, or the electrolyte from the electrodes is left on the skin. Well, we're gonna clean it, right? Record removal procedure on the patient chart. So you're gonna record there patient's Holter monitor was removed at this time, and you put your initials because it is legal information that you're recording on the medical records of the patient. Look at this. If the patient has forgotten to bring the diary, that's a problem. Monitor should not be removed because results cannot be evaluated. So before you start doing anything, give me the money. Where is the diary? Ask the patient. Oh, I left it at home. Okay, hold on a minute, please. Have a seat right here. I'll be right back. And you will talk to the doctor. Doctor, Mr. or Mrs. Smith, she's back here to return the Holter monitor, but she didn't bring the diary.
You gotta go back home and do it all over.
All over again. So the doctor is going to come over because the doctor is not going to put the medical assistant in this situation. Because you know what the patient is going to say, oh, no, I'm not going to take this. This was very uncomfortable. And even though if it is for the good of the patient, sometimes we don't value that. So the doctor comes over and tells the patient, what happened to the diary? Oh, I forgot. Sometimes it's not that they forgot. They never make any entrance on those diaries. So if you didn't bring the diary, you open the diary because it's your job. As soon as the patient gives you the diary, you have to review it. Okay. Oh, wait a minute. I have only 2 entries right here. So in a period of 48 hours, you didn't eat, you didn't go to the bathroom, you just, the one that I started right here and one that you did at home. What about anything else? If it is incomplete, it's not good. If you didn't bring it, it's not good. So then, we're gonna do the whole change because we're gonna change the monitor because we're gonna give you another one that has a full battery. We're gonna give you another chip because the other one is full and it's not. No, it doesn't work. So we're gonna give it to you for a period of 48 hours again. So that's what we explain to patients before they go home. That is very important to complete the diary and to follow all the instructions that we gave in there. You know that every single time that we get the test, what is it that we need to know about? Results. Because they come to us and we are the medical assistants. So, first of all, we don't have the results anyways. But the right thing to tell them is, well, if the doctor has done a good job when they are there with the patient and when they order this procedure to be done, they're supposed to be telling the patient, when you do this procedure, 48 hours later, you're gonna be in this monitor, then it's gonna take this time for you to get the results. But the patients always have problems, issues, they forget everything. So you're gonna tell them, according to the protocols, always follow the protocols of your office. If you don't know, don't tell anything to the patient. what you can do is, Mr. and Mrs. Smith, give me a couple of seconds, let me go and find out. Because remember, everything that you tell them, they're gonna trust you. And if you tell them that the results are gonna be there in 3 days, 4 days, 24 hours, they're gonna be waiting for those results.
Mm-hmm.
Tell the patient to follow the instructions, they don't follow. But if you tell something, they want you to follow on that. So once again, usually takes between 7 to 10 working days to get the results. Remember, this has to be evaluated by a cardiologist, so it always takes time. Now, if the cardiologist notice that there's something serious, they're gonna contact your doctor, or they're gonna contact the patient, correct. So those things happen. But when something is not kind of serious, it's like your blood results. Whenever you go to the doctor, they draw blood, right? Sometimes they don't even, if you don't call to find out, they don't even bother. That's called negligence. Even though if you don't have anything, your job is to tell me because I'm worried. You draw some blood. I'm waiting for those results. Anything that you do, I need to know if they are okay or not. Oh, if I don't call you, well, that means it's okay. How do I know that? We have patients that they weren't called. Nobody gave them the results. Doesn't imply that it was good. I worked with one of my colleagues, and he was sued for malpractice because he ordered a test for this patient. He never got the results, and the patient had cancer.
Oh.
And when the patient went to the emergency, then they said, "Oh my God, how? Where's your doctor?" They didn't order any test. You didn't have no symptoms before because this is already advanced. So then say, because remember, when you have symptoms for cancer, it's already advanced, and sometimes it's not much we can do. And that's what happens. Oh, then he found out when he has the court order, right? They send him the notification. He had to go to the court. Then he started looking at the papers. Oh, bingo. He found the test and it was right there. And they called the office and the nurse answered the phone to tell the doctor that make sure that they contact the patient immediately and run other tests because the patient has come positive for something.
And the nurse never told the doctor.
Never told the doctor, and the doctor never reviewed the test. If I order something, I have to review it.
So whose fault is it?
All of them.
Yep.
Okay.
Malpractice, that goes, remember, malpractice, if you are the owner of the office, it goes to you, anybody who works there. If it is a hospital, it goes to the hospital. So everybody loses. And then, what excuses you gonna make? Oh, the nurse didn't tell me? No. What about you not checking the results from the labs that you send the patient to? So this is not the time of making excuses. That doesn't work that way. So always tell the patient, says, follow manufacturer's instructions for preparing recording for evaluations. Final interpretation may be done by a physician. Remember, this is always a cardiologist. See, usually cardiologists. Now, once again, sometimes we don't have a cardiologist in our office if it was your medical doctor who ordered this. So your medical doctor, your primary doctor is going to send this for a cardiologist to be reviewed. So that's going to take some time. But once again, if something is serious, they're going to contact the doctor. Immediately, the cardiologist is going to contact the doctor. But one of you might be receiving that information. Remember, sometimes the doctor don't contact the doctor directly. It should be that way when something like this is serious, right? But sometimes, if you have personnel over there that is answering the phones, you're gonna call, whether it's the medical assistant, the nurse, then whoever else, they should relay this information immediately to the medical doctor. Anytime that we have blood results that are, abnormal, seriously abnormal, somebody has to mention it, because the lab calls, because they have the results and they have not completed all the results, but they call immediately for something that they have. So the person who answers the phone has to relay this information to the doctor. And if the doctor doesn't do anything, that's a problem. But you, as medical assistant, you record it on the patient medical record. I receive a phone call from the laboratory, who's the person that you spoke to, this time, at this hour, regarding this test, positive, blah, 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 and you put your initials. If something happens because you relay this information to the doctor, and the doctor ignored it or forgot or something, that's not your problem. You did your job. You're not going to be in trouble. The doctor is going to be in trouble. Because that's what everybody does, remember. When somebody gets in trouble, they always drop it to someone else. There's always the fault of the medical assistant, the nurse, someone else. Oh, the doctor's never the fault. No, that's your job, that's your responsibility. You are on top of all these people, and you are the one who's seeing the patient. You are the one who ordered a particular test, procedure. So you should be on top of that as well, waiting for those results. Not waiting for the patient to call you to ask you whether they have something or not. Reporting results, ensure cassette or results. Well, remember, those monitors back in the days have a small cassette or a disc. Not anymore. Now it has chip, remember. Patient's name, medical record number, date, physician's name, other identifying information. So when the patient returns this monitor, the first thing that we do is we write all the information on a label, and you put it in an envelope or in a little plastic bag, like the Ziploc bag. We put the diary there, the monitor or the cassette or the disc or the chip. We put it right there with all the patient information and give it to the doctor. Doctor, here is the monitor or the disc or the cassette or the chip and the diary of patient Mr. or Mrs. Smith, and you have all the information. Remember that it was Dr. A, the one who ordered this Holter monitor, is Dr. A who should be receiving this information. You're going to be working with 1, 2, 3, 4 doctors. You're going to know their names. You're not going to know every single patient that comes to the office because there are too many. But if this patient got an order from Dr. A is going to receive that. Dr. B is going to receive that. So don't give to Dr. C something that Dr. B or A ordered. And I'm telling you this because I have a nurse giving me some documents, some lab results from a patient. Said, oh, can you evaluate this because the patient is here? I said, no, these are from doctors. Oh, but you're a doctor, aren't you? Oh, seriously? That doesn't work that way. Yeah, I'm a doctor, but that's not my patient.
And don't certain doctors take certain insurance? So you could take this insurance, the other doctor could take
that is also correct. And most importantly, we respect their patients. It's like your clients. It's unethical that I'm taking your clients. No. What do I know about this patient? Nothing. It's not my patient. I don't know what problems the patient has. I don't know what is the diagnosis. I don't know what the doctor is. Yeah, I can look at the results and see there are some issues, but I don't know what this patient told the doctor about, and I don't have the right to go and look the medical records of the patient. No. Just because I'm a doctor doesn't mean that I'm gonna look at all the medical records of every single patient. No. My medical records I'm not being reviewed by any of the other doctors. It is me, and I'm responsible for that. And if I have a director, a supervisor, they can come and review them. But not anyone of you can do it. And your patient is your patient, and you follow with that patient, and any information that comes from that patient to that doctor goes only to the doctor that is seeing that patient. Don't let anyone fool you at work, because these people play games with you. Sometimes they're gonna get you in trouble. Go put this on Dr. Sach, and you see that the doctor's name doesn't match what they're asking you to do. Don't argue with them. Tell them, oh, wait a minute. You say Dr. This? I forgot. You mean this doctor, right? Make sure that you just don't receive the paper and just go place it over there. Factors affecting accuracy of the tracer results are improper lead attachment. So it can be many factors that, we're not gonna see accurate results. If you don't apply the electrodes correctly, or you apply the electrodes correctly, but the wires are crossed, you're not recording correctly. Incomplete patient's diary. Not completing the patient diary or being incomplete, part of it was completed, but 48 hours, how can you do only 2 things in 48 hours? Remember, you tell the patient that actually that's the job of the doctor, but you reinforce the patient. Remember, you can continue to as soon as you start going home, you continue doing the activities that you've been doing normally, except you're not going to be taking a shower and doing this and that. That's a different issue. But you're going to continue doing your daily activities. Don't stop doing anything, because that's what I want to check. What is it that you're doing in that particular moment, in that particular activity, that is causing you to have the chest pain or the shortness of breath? Because that's what we give this monitor for you to take it home. Because we don't know if it is when you're resting or when you're doing something. And I need to know what is it. That's what you have to complete the diary. Writing the time that you are doing certain activity. Making sure that if you have symptoms during that activity, you record it as well. So when we compare the electrocardiogram with the diary, they match, and it says, oh, at this time you were doing this. Now I know what's causing you that chest pain or that shortness of breath. Other than that, it's going to be very hard. Said right here, failure of the patient to maintain normal routine. Remember, if the patient is going to be with this machine and is going to go see the whole 48 hours or lay down, I'm not going to see anything on an EKG. Because it might be when you're doing activity that happens. So, and what type of activity, remember? So we have to record every single thing. If results are sent to an outside lab, report can take 7 to 10 days. Usually that's how it is. Once again, if something is serious, the cardiology is going to contact the office. The most important thing right here is that the patient needs to be aware of everything, every single instruction. And remember, we're going to give the instructions not only verbally, but we're going to give the instructions in paper, written instructions. And more importantly, has to be in the language that the patient speaks. It's not that the son, the daughter, the neighbor speaks English or whatever language it is. No, it has to be the language that you speak, because you are the one who's going through this. You are the one who's going to be there these 48 hours dealing with this process. So abnormal results. Now, what happens when you receive this abnormal? Electrical conduction defects in the heart's rate and rhythm controlling system. But if you have something abnormal, it's because some parts of the heart, whether the valves, whether the chambers, whether the blood vessels that attach to the heart are failing, right? Either or, because these are the parts. Rhythm abnormalities. Remember, we talked about rhythm yesterday. We talked about how to check the rhythm of the heart, how we use different methods to find out that. Premature atrial or ventricular contractions. So this is just to mention some of the things that might happen. If you have problems with the heart, whether it's the atria, whether it's the ventricle, whether it's your heart beating too fast, too slow, our pace is regular, is irregular, well, we're going to see it on an electrocardiogram. That's basically what it is. When we have abnormal results on an EKG, we don't stop right there. There are other tests that the cardiology is going to suggest the patient to get. So depending of what the findings were. So echocardiogram will be the next one. We use these tests in order of cause and specificity. Remember, when you go to the doctor, they start doing the lowest test. Is that understood? We don't go for the highest, the lowest, and if that goes kind of abnormal, we move to the next level, then to the next level. And the reason why we do that is because insurance will not pay if we jump from one test to the next. Insurance is a problem. So they don't like to pay for expensive things. See, if we go directly to an echocardiogram that costs like $3,000 to $5,000 versus a Holter monitor that the insurance is gonna pay $1,000 to $1,500, so they gonna go for that first. Now, if we will have to go for the next one, it doesn't matter. But sometimes just doing the Holter, we're gonna just stop right there because no findings. There were no medical conditions. Then we go for a coronary angiogram, then we go for a CAT scan, for an MRI, or even though for a more fancy exam. So these are decided according to, remember what the findings were on any of these prior exams or evaluations. Ooh, we finished. That is good.
Some more. That's a fun one.
Any questions about the Holter? Because Holter, few questions comes in the national certification. Remember, one of the questions that they ask over there is, for how long is the Holter on place? For how long the patient has to carry this monitor? 24 to 48 hours. Is it invasive or non-invasive? Non-invasive. And that's the good thing about it. Which one is one of those things that the patient should not do when they carry the Holter? Correct. Should not shower because number one, you're gonna detach the electrodes, you're gonna wet the device, you're gonna damage it. It's an electronic device. Okay. So let's take 10 minutes break, okay? A little bit to relax so your brain kind of go back to normal and then can start assimilating the next chapter. This is a short chapter, not because it's short, it's easy, so it's a little more complex. But we will go away. So you print out all this. Oh yeah, I received a message from you, from Gina. Said that you're still on the way, that you got stuck on the train.
Yeah, I was late. I was late. So she told me she
老师已经不想跟我说话了，不是点头就是摇头，
为什么？
不是点头就是摇头，
想睡觉。
不是，因为他说的我翻译不出来，我就点头或摇头，听懂了就点头，听不懂就摇头，所以老师已经对我无语了，点头摇头。
哪有呢？
哎，好冷啊！今天天气好热，我说我穿条裙子穿错了，还不如穿裤子。哎，
里面都很冷，里面都很冷，外面是热，但是我们这里
啊，是，我早来了，那个。
累死，想说今天本来不想来。
我还说你怎么来这么晚呢？不像你这劳模，勤劳之人叫劳模，中国叫5·1劳动人民。
累死。这好像有一点难，觉得，哎，有一点。
他们有开始出场的吗？
I'm almost done. I just gotta do. I got all the supplies. I just gotta do. What is it?
眯一下。
昨天我睡，今天你睡。
我不知道了。奇怪哦，像我们在国内啊，趴在桌上睡其实没事，可是我觉得在美国， 像我
Yeah, not
That's why I'm
咖啡
saying
厅啊
like,，
有时候就想趴着睡，然后那警卫就来了。说那时候要睡回去，想回家睡，不能在这里睡，然后就觉得，
So, and your son is huge, he bigger than you.
在国内啊，像我们在便利商店啊，累了就睡一会儿有什么？
and he's like, oh, and he like name brand stuff.
觉得没
He's
有
like, oh, don't cogerlo suave.
就是咖啡店在趴着，然后呢，他想眯一下，然后警卫就跑来说，就以为我没无家可归。
That's what I be telling the caller too. Do it. You have all summer. Do a little bottle. Get stuff here. Get stuff there. Just do it. You can go to worksheets and shit.
I would say that's fine. No problem.
He should have got your son out the way a long time ago. Like last month.
The girls
They
could have been like
easy.
this month.
They easy. The girls is easy.
The girls, you could really just go to
Easy.
Marshalls, TJ Maxx, and
Yeah.
get them like the Nike sets and
Yeah,
stuff.
the
No, they got they wear uniform,
Oh, you see,
You
that's
know?
even better.
which I'm gonna get that, but still like.
And I'm telling you too, because my daughter is 12. So last year, from the beginning of her 6th grade year to the middle, she jumped like 3 pant sizes. She wear woman size 2. Woman size 2 and she's 12. I don't know where the weight is at because she's so damn skinny. Like,
It's for the height.
so now I'm probably gonna have to see. She look like she, my daughter thick though. I don't know where she get that from. Like,
From you.
no.
Like she's
I don't
she's
have
really
no-
sitting here
I don't
saying
have
she
no
don't know.
butt.
But you got thighs.
You got thighs.
Yo, my daughter, I'm like, she probably wear 4 right now. I ain't seen her all summer, so she just came home. I'm like, you was eating all them people food, wasn't you? She got so big, yo.
How old is she?
She's 12,
Oh.
but she was gone for 2 months. So she grew like out of nowhere. I don't even know what happened.
It's like monster.
Mm-hmm.
These kids grow, they too expensive. So I'm one and done.
Yeah, one only?
Yeah, I'm done.
I'm done.
I got so much freedom,
three.
I'm done. I got too much freedom, so I'm done. I'm free every summer. I'm free
You have
every
what, how many?
summer.
Just one.
Yeah. 3?
My oldest is 16.
Yeah, kids are,
Expensive.
they're nice, right?
They are expensive.
And
But
annoying.
then having so
stressful.
many, oh no, forget it.
They're not very good.
My sister got 5.
See, the girls, I don't really go because I got them New Balance, Adidas,
Yeah.
you know, now the A6, they
Yeah.
look, you know, nice, and that's what I got myself so far.
Cause it's different for my
But my
nephew or my
son-
daughter. Cause my nephew, he's about to be 19. I can't buy him that. Me and my sister can't buy him new bag. But I buy my daughter, we can't buy him.
I got my son New Balance and A6, but he also wants Jordan.
Yeah, that's what they want.
You know, and stuff
And then
like
one pants for them is like $200.
Oh yeah, they want brand.
Yeah.
that.
Yeah.
Yep. So me and my sister we take
No,
turns.
sister. It's so real. She got a job in the sneaker store.
Yeah, for real, you need it. That little 25-30% off it counts.
Mm-hmm.
She don't even get a discount. She worked for like the private sneaker stores. She worked at Legacy on 34th Street.
That's messed up. They should have even said that.
Yeah. They don't give her no discount.
Well, it's time for her to change.
Oh no, she got another job. She do security overnight, and then she do that.
Oh.
Mm-hmm.
You gotta have 5 jobs living on.
Yeah. My son, he was like 19. He was living with me at that age. And He said, oh, Daddy, I want all these. Asking all these brands that I didn't even know that exist.
Mm-hmm.
Oh, I want this and I want that. So listen, son, I think that it's time for you to start, taking your own responsibility seriously. So why don't you just start working? So I said, me working? I said, yeah, why not? What is wrong with working? See your cousins, they go to university, and whenever they have off, they have a job. So why you're not having it? Because I don't need it. Oh, but all those things that you're asking me for, oh no, because you pay for it. Seriously? Like I said, no. So just to make the story short, I have a friend who owns 7-Elevens, right? So I said, listen, when am I gonna find a job? Nobody's gonna give me a job just for a weekend or something like that. They said, oh yeah, I can get it for you. Okay, get it, and I go. I got a job for 7-Eleven. This is my friend. So I said, listen, I want a job for my son. Well, they were laughing at me, right? They thought that was a joke. I said, no, I have to teach him a lesson. That you have to really work hard. And when you work hard, you don't kind of release the money so easily. So I got him a job, and he says, oh, but I have to go on island, and I'm not going to take the train. I said, okay, you don't have a driver license. So how are you going to drive? Oh, no, I know how to drive. No, I know you know how to drive. But you need to have a driver license. So go get the driver license. I give you the money for that. Go pass the test. You don't need to practice because you already know. Because my friends, they allow him with the other kids to drive the car or something. I don't let my car. So he went and get the driver license, and I said, okay, go get the job. You know how long he lasted? He went twice. He didn't stay the whole time. Said, oh no, this is too much. I can't work like that. I said, see now, what is important for you to go get an education. You don't want to do this type of job? Oh, besides they pay too cheap. I said, no, that's the minimum wage that you will be making if you don't go to school. So I think that was like, an eye-opening for them. So I said, oh, wait a minute. And I get my car. And I was like not sleeping, thinking that something was going to happen.
You gave him your car?
Yeah. Yeah, I said, I'm not going to buy him a car because then it's going to be a problem. So I gave my car. And I was like, every 10 minutes, are you there already? Are you there already? Then when he got to the store, I called the manager. I said, listen, is my son already there? He said, no, he hasn't shown up yet. You know what he did? He stopped first, went to eat, went to chill, and then he went to the job.
He was showing off the car.
Yeah.
Like I'm driving now. Because that's what boys are liars, and they show off. When they're young, they show off. They be lying about the minimum thing. Oh, this is my car. Yeah, my dad got it from me. And your friends don't even know that. That ain't your car. That's really your dad's car.
No, and that was true because when the manager, manager from the 7-Eleven store, they get $17 per hour. Nothing. And they're in charge of everything. If somebody doesn't show up, they have to be there. So he calls and he says, what car your son is driving? I said, I have a Range Rover. This kid is driving a Range Rover and is working in 7-Eleven for $15 an hour. I said, listen, I have to teach him a lesson. Yeah. And I don't have another car, I have to give my car. Said, oh my God, you trust your kid. Said, well, I'm not gonna drive like an hour and a half back and forth, going in the morning and then in the evening to go feed him. No. I trust my son. He's responsible on that aspect. So I said, listen, you should not be driving fast because you're gonna lose your license. And believe me, I'm not gonna help you with that. And remember, when you graduate from college, I'm gonna give you the car that you want. So if you don't have a driver license, you're not gonna get it. So he has to behave, like you said. They like to show off to everyone that I have this and I have. I said, what car you have? I said, I want your car. I'm gonna get you one of those. So first he wanted BMW. He liked the X6. I said, I'll give you the one. I said, but you finish college. Believe me, you finish college, I'll work my behind off and I'll give it to you. So he said, oh, okay. And now he's telling all his friends that what he's gonna get. Remember, show off. But it's 7. You guys wanna take a break better? You gonna eat something? You know, this chapter is short, so after the break, we finish this and we'll call it goodbye.
Oh, sorry, I took that all right.
Mm-hmm.
Who's going to
Mine is only like one minute.
Mine's probably like second. I just took
Yeah, I cooked this too before I did.
probably not even
Yeah, me too.
probably still warm.
Me too, because I
Still a
bought
little
this.
bit warm.
Yeah.
I bought this. So I don't know for sure.
Use the microwave? Oh. never been a Catholic girl.
Catholic girls are probably the
You said it's Catholic girl. Where's that?
It was on the last was literally on 42nd Street in Grand Central.
Okay.
It was right there in the cut, and it's like mad nice though, like the aesthetic is like
That's just what they need to do. They need to fix it up now. Because it's so old. It looks the same.
It's
But
gonna
they
get
get food is good. Yeah. They food is
快完事儿了，
All those food is good.
还有一周，一周以后我们要分开，我们要线上，你什么时候走啊？
Oh, that
Over the wall.
you gotta go up the stairs. Yeah, they make.
你要在这上完这个课走啊？
Which one? Nutrition?
行，你必须要上完，
是模仿饶舌，
而且你有压力上。
上完的基本上是上很好，但是
I don't even know
上
how
一
it's
上
fucked
就
up.
会
That's
弹
what I
琴
do.
皮。
And I used to
确实是装的太多了，你输出不出去，
我要不要听压实力？
压的太多了。我现在有点儿那个什么，要醒了我已经。
好了，有动起来的就完事。
有这哎呀，面对面的还那什么，但我感觉视频的后期效果应该不是特别好。也跟下周开始这个没有下周了，这周再不是真这个下周没有时间了呀。下周4就，
所以我才问他。
反正这个东西也就快了，这个也用不了几天，不像这个。
我有时候有挣扎的时候再来就好。
但是它有个缺点，它不会那个什么，它不会线上教你。以前的老师还会线上打。
对啊，我就问他，他说他有线上教过，我说为什么这次我们都没有录？害我这样子手拿的时候。
还有那些人。
让人过来的，不要自己来搞成。